Swastiastu. Hello everyone, my name is Huliana Lim. I'm the representative of small group discussion B8 Udayana Medical School. In this occasion, we are going to present our student project with the given topic, breast abscess.
My name is Luh Wina Saraswati with last 3 digits name 142. Now we start from the chapter 1 introduction. The background of this student project is breast abscess can be defined as a local collection of purulent material in the form of fluid or pus in the breast that occurs as a result of a primary or secondary infection that is virulent so that it can be developed into a complication of mastitis. The occurrence of complication of breast abscess develop from 3 to 11% in women with mastitis, whereas 0.1 to 3% occurs in women who are breastfeeding. There are several etiologies of this breast abscess where the main causative agent belongs to the genus Staphylococcus, but there are other types of microorganisms such as Streptococcus, Enterococcus, and Enterobacteriaceae. There are several ways to immediately diagnose breast abscess with a physical examination. Detecting breast infection as well as ultrasonography remains the imaging modality of choice. In acute infection of breast, it can be associated with bacteremia, which can lead to sepsis. In chronic complication, there will be significant scarring of the breast if not treated adequately. Therefore, this breast abscess is considered as a serious disease if it is not treated with significant and appropriate treatment. The problem we are discussing in this student project include what is the definition of a breast abscess and how is it different from the normal breast? What is the etiology, epidemiology, and pathophysiology of breast abscess? What are the clinical manifestations of breast abscess? How to diagnose and what is the differential diagnosis of breast abscess? How is the treatment or management available for patients with breast abscess? What complication can occur in patients with breast abscess? The objective of the student project are to know the definition of breast abscess and its difference with normal breast, to understand the etiology, epidemiology, and pathophysiology of breast abscess, to know the clinical manifestation of breast abscess, to know how to diagnose and differential diagnosis of breast abscess, to find out the right treatment or management available for breast abscess sufferers, to find out the complication that can occur in patients with breast abscess. The benefits of this student project for us as a medical student include complete knowledge of breast abscess. The benefit of scientific learning is that we can learn more about breast abscess and know how to treat it. The benefits for the community include increasing knowledge in the community, have a better understanding of breast abscess, and the appropriate therapy for it. So that's all from me. The presentation will be continued by my colleagues. Thank you.
Good afternoon, Doctor. I would like to continue the presentation on the normal breast. I'm Annisa Nuraini with the last 3 digits of 110. So breast itself is located between 2nd and 6th ribs, medially to the sternum and laterally to the mid-axillary line. Breast component includes the upper outer part that is called the tail of Spence, which extends to the axilla, the inner part that consists of lobules, and the middle part that consists of the nipple areola complex. The main function of breast is for lactation, which includes synthesis and secretion of milk. Hormones that plays role here includes the follicle stimulating hormone, which help for follicle development and estrogen secretion, and estrogen itself that plays role in increasing breast volume, and then luteinizing hormone that helps the progesterone levels increase. Progesterone itself helps for the dilation of mammary ducts and proliferation of epithelial cells. Also lactogenic hormones that helps for the lactation. It includes prolactin, HPL, and oxytocin. Thank you.
My name is Gede Raka Samudra, number 023. Now, I will explain you about overview of breast abscess. A breast abscess is an accumulation of mucopurulent fluid inside the breast tissue that leads to complications of contagious mastitis. Breast abscess happens frequently enough in prematures or women who recently gave birth, aged between 18 and 50 years. Lactating women have a condition that puts them at higher risk of breast abscess, but non-lactating or premenopausal older women are also potential for it. Breast abscesses are infrequently found in neonates. Obese people and smokers are far more risky in terms of non-lactational breast abscesses than the general population. Breast abscesses are often caused by Staphylococcus aureus colonization on the patient's skin surface. Treatment for breast abscess is commonly including milk drainage by continuing breastfeeding, pus drainage by needle aspiration, open surgical drainage, catheter drainage, the use of antibiotics, and bed rest. Early references are important to avoid change into severe infection or even sepsis. That's all from me. Thank you.
Thank you for the opportunity. So now I would like to introduce myself. My name is Krishna Pramanda, name 128. So now I would like to continue this presentation about the etiology. Breast infection can occur for several reasons. A breast abscess refers to buildup of pus from your breast infection. Inflammation of breast tissue or mastitis can also cause infection. In addition, another cause is the entry of bacteria from the baby mouth into the milk ducts. These bacteria can enter through wounds in the breast tissue, nipple freezings, and cracked nipples. There are so many types of bacteria that are causative agents of breast abscess. Lactational breast abscess are most commonly caused by Staphylococcus aureus and Streptococcal species. In the absence of lactation, breast abscess are usually caused by presence of mixed flora such as S. aureus, Streptococcal, and anaerobic bacteria, or bacteria that don't grow in oxygen-rich places such as sites of the intestine. That's all from me. This presentation will be continued by my friend. Thank you.
Hello, my name is Azza Alfadhila with 3 digit student ID number 094. I will explain about the epidemiology of breast abscess. Infection of breast abscess are often associated with the condition of women who are breastfeeding, occurring in 10 until 33% of women globally. The global prevalence of mastitis in breastfeeding women is in the range of 2 until 3%, with 5 until 11% potentially develop into breast abscess. In the United States, 9% of 1,000 postpartum mothers who breastfeed report experiencing symptoms of mastitis, while the incidence of mastitis in Australia occurs in 15 until 21% of breastfeeding mothers. Meanwhile, according to Survei Demografi Kesehatan Indonesia or SDKI, in 2012 until 2013, 55% of breastfeeding mothers in Indonesia experience swollen breasts and mastitis caused by lack of breast care during pregnancy and inappropriate breastfeeding techniques.
Hello everyone, my name is Bagus Ugrasena. My digit number is 184. So today I'll talk about pathophysiology. So to understand more about the pathophysiology of this breast abscess, we should first know the location of human breast anatomy. All human breasts have sections called lobulus. These lobulus are empty into a lecherous duct and finally empties into the surface of the nipple. On the nipple, there is an area of lactosinus, which is a place for a mother's milk in breastfeeding. In lactiferous endocardia, what is known as epidermolysis occurs when the production of keratin results in the duct becoming blocked, which when the production of keratin, which eventually form as an abscess. Initially, the abscess was associated with lactation. During lactation, many germs and bacteria entered during laying experience abrasions. The infection usually appears in the second postpartum week and is commonly triggered by breast milk suspension. In this condition, the infected woman should not give breast milk to her child. A breast pump material to circle the air for the child as well.
Hello everybody, in this opportunity, I would like to explain the clinical manifestation of breast abscess. So first of all, I would like to introduce myself. My name is Putu Artika Darma and my student identification number is 2002511084. So let's start it. There are several clinical presentations which can be observed in breast abscess patients, such as localized tenderness, induration, warmth, edema, and sometimes fluctuant mass with overlying erythema of the skin. Furthermore, breast abscess patients can experience systemic symptoms, including pyrexia or fever, feeling unwell or malaise, chills, vomiting, nausea, tachycardia, tachypnea, and sometimes rigor. And also, the patient may experience axillary lymphadenopathy. So that's all my explanation about clinical manifestation of breast abscess. The presentation will be continued with my friends. Thank you.
Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Okay, now I will going to explain about the diagnosis. The fundamental diagnosis of mastitis or breast abscess is physical examination. It refers to the clinical presentation of abscess. We can start from anamnesis to know patients complain about the pain in lump. Physical examination may reveal signs such as redness, tenderness, and induration in the breast. To build the diagnosis, ultrasound is a useful tool to clarify an abscess that would be seen as a hypoechoagulation. The ultrasound imaging assessment with breast abscess was significantly high. A breast abscess can also be drained using fine needle aspiration for diagnostic and therapeutic purpose. A breast abscess is indicated by purulent fluid or diagnostic needle aspiration drainage. A biopsy is usually not recommended in cases of regular mastitis. In other cases, such as a suspected abscess, typical presentation, an uncertain diagnosis, or associated risk, a biopsy is more preferable. A tissue biopsy may also be performed to examine infection, granulomatous inflammation, or malignancy in involved tissue in the breast. Mammography is only occasionally indicated. Mammography has limited utility in the acute diagnosis of mastitis and breast abscess, but mammography is suggested to rule out the possibility of malignancy in non-puberal abscess. And then, in patients with a suspected sepsis, abscess, recurrent infection, or treatment failure, a full blood count or FBC with differential and blood culture are recommended. Okay, maybe that's it for the diagnosis. Next, thank you.
My name is Gloria Grace Melanita Sihite with last 3-digit number 162. And now I will continue the presentation. So there are several differential diagnoses. Among them, I will explain 3. First, galactosal. This is linked up to lactation where the cyst is present and the breast will be swelling. It is round-shaped and non-tender. The cyst might look similar to milk, but it is possible to differentiate it from a tumor. The second is inflammatory breast carcinoma or IBC. This is considered the most aggressive breast cancer. Inflammatory breast carcinoma is indicated by the appearance of pseudo-orange, erythema, and edema. Unlike other benign bacterial infection, patients with IBC don't go through fever, which is one of the infection symptoms. Next is plaque duct. The clinical appearance shown is a soft lump in the breast, which is caused by plugging in the collecting duct. And to manage this, the mother is allowed to continue breastfeeding whilst massaging the area around it. That's all from me. The presentation will be continued by my friend. Thank you.
Good morning and afternoon, doctor. My name is Felix, with last 3 digit of student ID is 099. So I'm going to continue the presentation regarding the treatment. So in treatment of breast abscess, there are still no widely accepted guidelines. However, the most common type of treatment are incision and drainage, needle aspiration, and administration of antibiotics. The most standard of the treatment are the incision and drainage, which involves draining the pus. So first, incision and drainage are more often preferred because it allows further drainage through the incision site and also have a lower chance of recurrence. But it is more invasive compared to the needle aspiration procedure, which can leave a possible scarring and possible poor physical appearance. Second, the drainage of pus also can be performed through a needle aspiration with the help of ultrasound guidance. Usually, it's operated in smaller abscess on a lactational abscess. If there is a recurrence after this type of procedure, incision and drainage must be performed. The last one is the antibiotic therapy, which many choose if the patient is not comfortable enough in the surgical procedure. Antibiotic usually given before or after the procedure, and also if there is laxative in the surrounding area. The duration of the therapy is which involve 4 until 7 days. So that's all from the treatment. Next.
Hello everyone, my name is Natasya Pusparani with a 3-digit number of 227. And here I'm going to explain about complications of breast abscess. Majority of breast abscess cases usually have good prognosis. However, if not treated properly or immediately, it may result in complications. There are 2 classifications of complications. First is acute complications. Having breast abscess may require women to stop nursing the infant on that breast in order to prevent transmission of infection. So the infection occurs because the abscess, when lactating, most often occurs with laceration of tissue on the nipple area, which opens a pathway for bacteria to enter. Other than that, it may also be followed by acute pain, which may develop into chronic pain if not properly treated, and breast infections may correspond to bacteremia. Thus, sepsis can also occur. Second classification is the chronic complications. Infection from the breast abscess may develop into a fistula. Other complications may include chronic pain and disfigurement due to possibility for patients to have repeating or chronic infection. Scarring is also another chronic complication, as surgical treatments for the abscess, if not properly treated, may lead to it.
Hello everyone, my name is Angelyne Mulia with last 3-digit number 051. So next is the conclusion of this presentation. The breast abscess is a localized accumulation of mucopurulent fluid within the breast tissue. It occurs frequently in women aged between 18 to 50 years. The lactational breast abscess is usually caused by Staphylococcus aureus and Streptococcus species, while in the absence of lactation, it is usually caused by a mixed flora of Staphylococcus aureus, Streptococcus, and anaerobic bacteria. The global prevalence of mastitis is 2 to 3%, with 5 to 11% developing a breast abscess. The abscess formation is started with erosion or scarring of nipple. The clinical manifestations of breast abscess are tenderness, induration, warm, edema, and erythema of the breast skin. The fundamental diagnosis for the breast abscess is physical examination, and some tools are used to clarify the abscess, such as ultrasound, needle aspiration, biopsy, and mammography. The differential diagnosis that should be considered to avoid the misdiagnosis are galactosal, inflammatory breast carcinoma, and clogged ducts. The gold standard treatment is incision and drainage, while the other treatments for the breast abscess are antibiotic therapy, needle aspirations, and other surgical methods. Most breast abscess cases have good prognosis. However, if it was not treated immediately or properly, it may result in several complications that can be classified into acute and chronic. So next is references that we use. That's all from small group discussion B8. We would like to say thank you to our facilitator and evaluator, Dr. Mulia and Dr. Artika, and thank you for your attention.